What's going on, Sterile Gang? This is your guy Rick the Sterile Tech, and today I got 5 CRCST practice questions for y'all today. So let's lock in and see how many we can get right. Alright, let's lock in. Question number 1. After a surgical procedure, where should contaminated instruments go first? A. Sterile storage. B. Prep and pack. C. Decontamination area. D. Case card holding area. The correct answer is C. The decontamination area. Used instruments always gotta go through decontamination first. That's where the cleaning process starts. Before anything gets inspected, assembled, packaged, or sterilized, it has to be cleaned first. So if you pick C, you're on point. Alright, question number 2. Which of the following best describes bioburden? A. A chemical used during sterilization. B. The amount of contamination or microorganisms on an item. C. A method of packaging instruments. D. A type of surgical trays. The correct answer is B. The amount of contamination or microorganisms on an item. Bioburden is basically the soil and microorganisms sitting on that item before it's been fully processed. That's one of the reasons cleaning is such a big deal. Because if bioburden is still there, the next steps can be affected. Alright, question number 3. What is the main reason sterilization records should be maintained? A. To make trays look more organized. B. To reduce the need for cleaning. C. To support traceability and quality assurance. D. To replace instrument count sheets. Let's see who gets this one right. The correct answer is C. To support traceability and quality assurance. Sterilization records matter because they help track what was processed, when it was processed, and whether the cycle met the required conditions. That's huge for quality assurance for tracking things back if there's ever an issue. Okay, question number 4. Which statement about cleaning instruments is true? A. Sterilization can make up for poor cleaning. B. Cleaning should happen after sterilization. C. Cleaning is necessary before sterilization can be effective. D. Instruments only need to be cleaned if they look dirty. The correct answer is C. Cleaning is necessary before sterilization can be effective. This is one of the biggest concepts in sterile processing. If that instrument is not properly cleaned first, sterilization may not work the way it's supposed to. You can't skip the basics and expect the final step to fix everything. Question number 5. Which of the following is the best reason hinged instruments should be processed in the open position? A. So they can fit better in the tray. B. So the instrument looks more organized. C. So all surfaces can be properly reached during cleaning and sterilization. D. So they dry faster after storage. The correct answer is C. So all surfaces can be properly reached during cleaning and sterilization. Hinged instruments should be processed open because you want all surfaces exposed during cleaning and sterilization. If it stays closed, Some areas may not get properly reached, and that can affect the whole process. Now that was 5 CRCST questions for y'all. Let me know in the comments how many you got right out of the 5. If you want more practice questions and more sterile processing content, make sure you subscribe, and I'll catch y'all on the next one. And remember, Sterile Gang, continue to keep it sterile. Peace.